Thank you for joining us for our next webinar about exercise in Ramadan. Sorry we got a little late getting started, but we're just letting everybody come into the room and we can get started. We'll just give it another one more minute for anybody who wants to log in. We have a number of registrants today. More than 60 people have registered for today's event. I hope you can all hear my voice. If you have any problems hearing me, please send a message in the chat box. Welcome, Dr. Shiraz. Assalamu alaikum. Good? Excellent. Volume's low. Okay, well, let me just make some settings and I will try to increase the volume. Just 1 second. Is the volume better now? Mr. Abdurrahman, is the volume better? Okay, great. Okay, well, I think we can get started now. So we're going to ask you to please leave the questions for the end, and you can share any questions that you have within our chat box or in the Q&A box. So today we're going to be talking about exercise and Ramadan specifically, because a lot of people have concerns about Ramadan, how to do those exercises in Ramadan. And also we're going to be talking about the benefits of exercise specifically. So the outline for today's talk is we're going to be talking about the benefits of exercise, how it affects the brains, the hearts, the muscles, and what's its impact on weight loss, because a lot of people associate exercise with weight loss, whereas there's a lot of other benefits to exercise other than just the weight loss. So we're going to be looking at the goals of what our exercise should be. And we're actually very lucky today to have an expert on board with us, a fitness expert. We have Mr. Suleman Noor, who's going to be talking about the myths of exercise in Ramadan and how to find a balance, what to do and what not to do. And at the end, he's actually going to give us a practical exercise regime to follow in specifically in the month of Ramadan and what we can do in the future as well. And finally, we'll open up the for Q&A discussion at the end for the last 20 minutes so that we can invite all your questions at that time. Okay, so now we've got, mashallah, a number of people who've joined the room. Thank you all for taking out the time. All right, Bismillah ar-Rahman ar-Rahim. Salatu wassalamu ala Rasulillah. So the benefits of exercise. So we all know that exercise has tremendous amount of benefits for us. And it improves it improves almost all the systems in the body. Yes, it improves your joint health, which includes your muscular health. So a lot of the joint and muscles improve their functionality as a result of exercise. In fact, the more you exercise, the more a process happens in the muscles, which we call muscular hypertrophy. And if you don't exercise, the opposite happens. It's called muscular atrophy. So exercise helps the joints, helps the muscles, improves the cardiovascular health, increases the delivery of oxygen, because with exercise, you're breathing better, there's better blood flow in the lungs, there's better transfer of oxygen from into your blood and from your blood into the tissues. And it actually washes out from your body tissues certain acids. So what happens is that with time, we have these acids that build up in our body muscles, and these acids are washed out as a result of the blood flow that goes through them with the oxygen. So the more you exercise, the blood flow increases to all those areas in your body and washes out those acids. And it improves the flexibility of your body. So a lot of the joint flexibility improves as a result of exercise. Exercise helps reduce stresses that accumulate, and it allows a person to relieve himself of those stresses that are inside his body. and helps improve their mental focus. And this has actually been well studied, and a number of studies have shown that there are these certain transmitters in the brain that are called endorphins. And endorphins are the stress hormone of the brain. And when you're exercising, there's a lot of increased blood flow and activity in the brain that has been mapped out. And so it has been shown that the exercise improves the mental function, such that we found people have improved vocabulary, improved memory, short and long-term memory, improved attention span and coordination, and they're able to improve their focus. And also it improves their ability to learn different new things. So exercise dramatically improves the neurological function of a person. And by not exercising, actually, they're not able to develop their mental capacities at that level that they would otherwise with exercise. So exercise has a lot of benefits for the neurological function. And then coming down to muscles. So when we exercise, what actually happens is that you get these micro injuries across the body's muscles. So all the muscles, as you can see in this picture over here, they get these little injuries. And these injuries release a certain chemical in the body that are called cytokines. These cytokines then travel in the body, go to the blood, and invite these special cells, special white blood cells, that come in and start doing the repair work. And at the same time, it stimulates those muscular cells to start dividing and creating more muscle fibers. And so you can see in these, the red cells, these are actually activated muscle cells that are now dividing and making more and more cells in a process that we call muscular hypertrophy. And so actually you improve the amount of muscular, the muscle health by improving their muscular mass and improving their muscular function. So it's a combination. So you exercise, it induces injury. That injury stimulates a repair process, which stimulates muscular growth, hypertrophy. And when your muscles are going through hypertrophy, they require a certain amount of special nutrition called proteins and amino acids. So when you eat proteins, the right amount of food of proteins, so that protein is broken down into a building block called amino acids. These amino acids help build muscles in the body. A lot of this repair work actually occurs during your sleep. So you exercise, you eat well, and you sleep well, and it improves your overall body health, a combination of all three of them. So if you look at this, we've got muscles all over our body. And by doing various exercises, a number of these muscles are stimulated and they start improving their health. Just like we've looked at previously, how the muscles then start growing and getting stronger. So any type of exercise we do will stimulate the muscles to improve. And so it is better that one chooses certain exercises that stimulate a number of muscles in the body, muscle groups that will improve their growth. Walking is an excellent exercise, but it's pretty much limited to the lower body muscular group. And so some sort of upper arm exercises are important to improve the muscular strength of the upper body as well. And they don't have to be done outside. A lot of these exercises can actually be done at home. And so by doing these exercises at home, you can see how they are improving the core health, which we call the core body health. So these are the muscles in the posterior part of the back. This is an exercise which is called the bridge exercises. The bridge exercise is basically you just lay down on the floor or on an exercise mat, and you tighten you make sure your feet are well fixed against the ground. You push your heels onto the floor, and as you do that, you raise the mid body, the core, and that improves the muscular strength of the abdominal muscles and the back region. And it's a very good exercise to improve the core strength, is what we call in the abdominal area. And that's important because the abdominal area doesn't have much bone. We don't have bone there. We only have a little bit of bone in our back, but the mid-core is only muscle. It's basically a cylinder of muscle that needs to be strengthened to improve the posture and improve the overall muscular strength of the body. And when we do these exercises, it's not necessary that a person actually sees a change in weight, but there's a lot of changes that happen in the body composition. So this is a patient of mine, and they came to our clinic where we did the body composition analysis. And this is the analyzer is shown in the picture over here. This is what we have in our clinic called the body composition analyzer. And so you stand on it. It only takes like 2 minutes and send these very insignificant electrical currents through your body and measures the amount of muscle mass, the fat mass, and the amount of water is inside your body. And so we get this graphical analysis. And so this patient came to me on the 13th of March, and we did their body composition analysis. His weight was 102 kilograms, and the muscular mass was 37 kilograms. And he had about 34% of his body was fat. So we encouraged him to do some exercises and a little bit of changes in his diet. He didn't really do much dietary changes, but he did do the exercises. He started walking every day for about 20 minutes. He started jogging for about 10 minutes and doing some flexibility exercises for about 10 minutes. And as a result, when he came back in a month and we did his composition analysis, he was very impressed that he saw that there was about a 1.5 kilogram drop in his weight. He was hoping for more, but then he was really happy to know that he actually gained 0.5 kilogram of muscle in this one month. And he actually dropped the percentage body fat. So the more the muscle you build, the lesser and the more fat you burn out. So the percentage body fat actually drops down. And as a result, the excess water also reduced in his body. So that was a big happy change that he saw as a result of the exercises he was doing. But exercises are not only good for muscles and brain, but it's also excellent for the heart, because what happens is that the heart is a pump that's supplying blood throughout our body, and it needs to have good blood flow. So the heart is a muscle that's continuously acting, and it needs a good amount of oxygen delivery to it. And the oxygen is delivered to the heart through these blood vessels. So these blood vessels can start getting clogged by cholesterol. So cholesterol starts depositing in the blood vessel, and the normal blood vessel is this size, but it starts getting narrowed down, and so the blood flow can get reduced to the heart, and that weakens the heart muscles, and as a result you can even get a blockage. So these blockages then end up having causing injury to the heart muscles, what we call a heart attack. So a heart attack is basically a blockage of the blood vessels to the blood flow to the heart, which leads to an injury to the muscles of the heart. When we do exercises, what we found is that there are certain chemicals that are released into these blood vessels called nitric oxides and anti-inflammatory myokines. So what they basically do is they improve the flow of blood through the blood vessel. So for one, it starts making the blood vessel larger. So the size of the blood vessel gets larger, so it can accommodate more blood flow. And it actually starts clearing out a lot of the cholesterol from within the blood vessel and improving collateral blood vessels. So what is collateral blood vessels? That's an important thing here. What happens is that as a result of exercising the heart muscles stimulate new blood vessels to grow. So even if you have a blockage in one of the major blood vessels, there's some new blood vessels that grow around it and allow the blood to go through, to allow the blood to reach the heart muscles, even without having to go through the major blood vessels. So you have blood going to the heart muscles from what we call collateral vessels. So these are side branches that start developing and improving the delivery of oxygen to the heart muscles even though there's a mild blockage in the major vessels. And so the potential for injury is reduced. And so you reduce the amount of injury that the heart might sustain as a result of the blockage. Not only is the exercise good for increasing the size of the blood vessel and clearing out the blood vessels and growing new blood vessels in the heart, but it's also good for improving the nerve function of the heart, which is called the brain-heart connection, which is called the autonomic nervous system. So it prepares us. So you know, when we have some sort of a stress event in our life and you start feeling your heart beating really fast. So that stress event causes the hearts to start pumping faster and beating faster. And that amount of stress on the heart is reduced as a result of exercises. So the autonomic nervous system is improved as a result. Okay, let's switch gears now. Let's talk about a little bit about calories and weight loss. And so we have to understand how does exercise impact our weight. Now, the amount of calories that we eat are used up in different ways. So a lot of the calories that we eat are actually burnt just to provide us the regular basal amount of energy we need to live. So it's called the resting metabolism. And I mentioned that in our last lecture. It's called the basic metabolic rate. So a lot of that energy is just used. It's the yellow bar that we can see here. It's the largest part. It's just resting metabolism. So a lot of the energy we use up is just by spending our days sitting down or laying down. And then if we're moving around, doing work, going around for shopping or for work or for exercise or going out for a walk, so that is called physical activity. So that's the blue bar here. And then there's some amount of energy that we actually use to digest our food and also to create heat in our body, which is called thermogenic energy. So that's the red portion over here. And of course, if you need to burn more heat, then that increases, but it's usually the smallest part of what we use in our calories. So when we start reducing our caloric intake by doing a diet or increasing our caloric expenditure by exercising, we would expect that we would burn more calories, but unfortunately, if you can see here, see the difference here? Our body tends to conserve calories by reducing the resting metabolism. So we might be exercising or reducing our food, in an effort to lose weight, but our body, it does counter efforts. It reduces the amount of energy we're using in our resting metabolism, and so it conserves more energy that we're spending in physical activity. And so what happens is that you start off with doing a diet, and after a month of doing a diet, you see a drop in weight, and then there's a plateau. When you reach the plateau and you're still dieting and the weight is not coming down, people tend to give up at this point in time. But if you continue with your diet and you add exercise over here specifically, or you increase the amount of exercise, you make that adjustment, you're able to bring that weight down. And so that is why consistency and persistence is very important. And so this is a graph that's showing what happens is that somebody's overweight and their body weighs a lot, and so they're exercising over here and they're doing a diet. And at this time, when they're exercising, because of the amount of weight that they have, they're burning more energy in that same amount of exercise. And then they hit that plateau. When you hit the plateau, the reasons are, as I said, either slower metabolism or increased hunger, because your body tends to increase the hunger hormones in response to all of these changes. And then you start, you've lost a lot of the excess water, and that was also part of the weight, and you start losing interest. But it's at this point that you need to increase the amount of exercise you're doing and be persistent with your caloric restriction, and you will see that the weight will start coming down. And you've noticed that at this time, you're actually losing lesser energy with that same amount of exercise because your body's able to conserve energy, and number two, you're weighing less, and so the stress that muscles are tolerating is less as compared to before. And so we need to have certain goals of exercise. So there has to be a goal that has been described by a number of studies that if you want to actually have meaningful benefit of weight loss with exercise, is that you need to do a moderate level exercise, 30 to 35 minutes a day. So I wrote 30 to 35 because if you're exercising 7 days a week, you can do 30 minutes. If you're doing 6 days a week and taking 1 day off, do 35 minutes. And so 35 minutes a day, 6 days a week is a good formula. So you can do either walking, brisk walk. You can, and if you have joint problems, you can do it on the elliptical. So you can do this brisk walk either on the treadmill, or you can do the brisk walk in a park, or you can use an elliptical, which is much softer on the joints. So with an elliptical, there's no joint. The joints are not absorbing any shocks. So there is a lot of shock absorption by the joints when you're doing walk in a park or on a treadmill, but that shock is reduced with an elliptical device. Similarly, a stationary bike is actually very good as well if you're not able to stand, because an elliptical requires you to bend forward, and it's good exercise for your upper body, the mid body, the core, as well as the lower body. But if somebody's having difficulty with that, then the next option is doing a stationary bike. And if nothing, you can always do 30 to 35 minutes of flexibility exercises. So you do all sort of body flexibility exercises, and there are a number of exercises that you can learn from fitness experts. I'm sure Mr. Suleman is going to sort of highlight a little bit on that. And if somebody would like to do lesser time, then it's better to choose a moderate to vigorous level of exercise, which is 20 to 25 minutes a day of either swimming or jogging. And this will help you see the benefits in the weight loss. Now, in order to get a better understanding of what are those exercises and how to do them in Ramadan, we're going to move over to Mr. Suleman, and he's going to give us a 15-minute talk on the exercises that you can do in Ramadan. Give us a minute so we can switch the screens over here. Suleman, would you like to please share your screen with us and take over? And Hamad, if you can please help switch over the panelists.
Yeah, sure.
I'm going to stop my share. And Suleman, if you can please give us your share.
Yeah, sure.
Welcome, Mr. Suleman.
Yeah, can you hear me?
Yes, we can hear you very clearly. Please go ahead. I'm going to mute myself.
Okay. Yeah. Can you see the screen? Okay, how's everyone, guys? My name is Suleman Noor, and as Dr. Tahir has introduced me before, I'm an Australian certified fitness expert and the director of the Fitness Lounge. And I'm here to talk about what to do, what sort of exercises, and how can we maintain our health in the month of Holy Ramadan. Okay. I came across a lot of times the misconceptions and the myths that people approach out, and they say we can't do exercise during the month of Ramadan as we have like a lot of physical weakness during this month, or we cannot keep up with a balanced diet, or we cannot keep up with our busy schedule, and it's wise to stop the fitness routine. There are a lot of myths, even more than that. So I totally disagree with this, because obviously to maintain our health and to keep our body fit and to keep for a well-being, I think exercise is a must. And to cover those points, I have made this little presentation on that, which I will be sharing it with you guys. So what are the reasons that why we should be exercising during Ramadan? There are a lot of reasons which I have addressed briefly. So number one is exercise helps us to maintain our mental, and it clears out of a physical detoxification from our body. Like for example, if we have a lot of detoxification in our body, like whatever we're eating all over the year, or for example, a lot of people stay on junk food because of their lifestyle, or they don't have time to cook healthy meals and stuff. So it's one of the main basic expect to clear out your detoxification from your body, and actually give you a clear picture about your mental point of view. And it also impact directly on your stamina and your bone health, as Dr. Tahir has mentioned before. And also it will create a lot of things which elevate the process of your sense of self-being. And in a medical point of view, Dr. Tahir can explain this, have explained this better, and I will be telling him to explain to you in more details if anyone have a question later on. We have LDL and HDL in our body, which is lower cholesterol, where people have a lot of time problem with diabetes or high blood pressure and all this kind of problem. So exercise do help a lot in these kind of things, which I have seen personally. My clients come up to me, and when they have like high blood pressure or they have diabetes, it actually helps them a lot. And people who have diseases like BP and higher cholesterol, always recommended to incorporate physical activities in their routine, which obviously, because it manages the healthier BMI and gives you an active sense of self. And another very important factor which plays the physical activity all fuels your mental health as well. You got neurotransmitters in your brain. For example, what do you call it? Serotonin, endorphins, and stress hormones. Exercise controls these sort of hormones. It actually puts your hormones in a balanced way. So keep talking about fitness. How can we manage all these? How can we keep sustain, or how can we motivate ourselves? This is a very common question I do get asked from people, especially in the month of Ramadan. So I always suggest them to find a goal, have a small goal, and go from the small goal to your bigger goal. Like for example, if someone wants to lose weight, or someone wants to get rid of the body fat, so have the balanced routine in your lifestyle, and get rid of your distraction. Like if you have a lot of distraction going on in your life, you won't be focused on your fitness or anything in your life. For example, like if you have stress built up in your life, or if you have any physical other problems, or if you have any family problems, you gotta stay consistent on one thing at a time. Like if you have so many things going on in the same plate, you won't be able to motivate yourself, or you won't be able to dedicate yourself. And always try your unrealistic goals. Don't have unrealistic goals. Like for example, if someone come up to me and say they wants to lose 20 kg in 1 week, that's a really unrealistic goal. It's not going to happen. So have realistic goals, and always have your sub goals while continue to reach the bigger goal. For example, if you have a bigger goal, start from something small, and which will help you to take you to your bigger goal. Does that make sense? Obviously, when you have a smaller thing to achieve first, like you will get something smaller, and then keep going and build up your stamina, and build up your routine, and build up your body in a way so you can achieve more. Like obviously you won't be able to get 6 packs in 1 month or 2 months if someone has like 20 to 25% body fat. So have a sub goals, like small goals. Always reward yourself. How can you reward yourself? Like whenever you achieve something, it's the body mechanism is very funny. Like if you keep consistent about something, like your body start to get bored, and it will adopt the habit. Like you gotta reward your body in a way. Like for example, I do reward my body in a cheat meal way. Like I take cheat meal every once in fortnight. So it's a cheat meal. It can be used as a positive reinforcement, and always seek help. If you're not sure what to do and where to start from, always reach out to a professional and always seek help. Let's come to the exercise point of view. As I said, always in a month of Ramadan, as everyone is fasting these days, so always start from the moderate exercise. Don't go for high intensity exercise. Use your home equipment. If someone don't have any equipment at home, there's nothing to worry about. You can even go out in a park or go for a jog, like brisk walk, or a normal walking. Or if you have a gym membership, then go to a gym. But I don't suggest during Ramadan to go to a gym or go for a high intensity workout during whenever you are fasting. For example, if you have a weight loss goal and you want to lose weight, I always recommend to go for a workout 30 to 40 minutes, as Dr. Tahir suggested, before the Sahri or after the iftar. Because when you are in a fasted state, you're you already be a lack of energy, and so you won't be able to perform your workout as efficient as you could after the iftar or before the sahri. And it is always do a workout. If, for example, if you want to lose weight before Sahri, if you can do workout and then go for your sahur, or similarly before iftar, if you want to lose weight, do your high intensity workout or small amount of workout for like 20 to 30 minutes. Because when you are fasting, your body use your store fat as a form of energy. Your body does not require a food, or it does not require any other food. It just use the energy from your body already having storing fat in yourself. So that's a very good point of view. If you someone want to lose weight, or someone wants to lose fat, always do little cardio, or 20 to 25 minutes cardio before the sahur or before the iftar. At home, how can you do exercises? Just start from a body weight exercises. There are a lot of body weight exercises you can do at home. Like, for example, you can do push-ups, you can do body weight lunges, you can do body weight squats, and etc. etc. There are so many exercises. You can find it on the online. Just follow some online workout routine. Always have on your laptop or PDF phones or whatever devices you have. Always have it right next to you, and just follow them up. And it's so easy these days. A lot of apps are available over the internet. You can download any efficient application. And also, I have my own YouTube channel and my Facebook and Instagram channels. I normally put online workouts as well there. So if anyone wants to see where to start and what sort of workout they have in their mind, they can reach out always, and they can follow from that kind of channels as well. Let's talk about the general guidelines here, guys. For example, if everyone individual is different, like for professional or for customized diet plans, we do have customized diet plans and customized workout plans. But for people who wants to just follow the general guidelines, I do have some few steps to follow up. Like, as I said before, smaller changes will help you to achieve bigger things. So always schedule your 30 to 40 minutes per day of active time, or practice any sort of physical activity. Like, it doesn't have to be a gym, or it doesn't have to be a weight training. You can choose any sort of physical activity at home, or in a park, if you have a park close to your house or something, or if you are going, or if you are traveling to work, or if you are going to anywhere using a car or public transport. I always suggest my clients to drop one stop ahead before, and you can walk, rather than using your car or using your bike or using any automotive kind of thing. Like, I rather suggest my clients to be more mobile. Allocate some time for yourself on latest health research, and and take them part of your incorporated lifestyle. And when it comes to the fitness and your exercises, I always suggest that do not go for a heavy workout, because it's going to burn out. Like, for example, like if you are already obese, and if you already have a heavy weight, I would not suggest anyone to go for a heavy workout from the beginning, because you won't be able to cope out. You're gonna burn out your energy, and you're gonna be puff out, and it won't be easy on your joints and all that too. Always go for low intensity cardio, which is 60% of your heart rate. Do not exceed more than 60% of your heart rate, and have a convenient regime. For example, if I have my regime after I go for workout after 2 hours of my iftar. Whenever I have my food, I take about 2 hours to rest down, and I go for my workout. And during the Ramadan, I have come across a lot of people. They said they don't feel good about themselves, because obviously we in our body is 70% is water. We gotta stay well hydrated. You gotta drink a lot of water, and it's always remember that our body has what do you call it? Our body has 70% of water in our body. Sorry guys, my presentation is playing up a little bit. Yeah. So yeah, so 70% of our body is consists of water, so we gotta stay well hydrated. Food. What we need to eat during our Ramadan season, and overall, it's a very good habit to keep it like good food and clean food to be part of your routine. But especially in Ramadan, your sahur, especially, and aftar is your main meals in Ramadan. So I normally suggest in sahur you should be taking complex carbs and last longing energy foods. For example, you take whole wheat or oat, beans or rice. Similarly, you can choose raw unpeeled fruits in your diets, which will take time, and it digests slower in your system, and they are rich in fiber. Always try. I prefer to use fresh juices in your diet. Do not go for concentrated juice, which are very easily available in the market. But I normally not suggest people to use this sort of juices. Always go for the fresh juices, and always avoid fried foods which are high sugars, and avoid high sugar foods, and always have a food which are high fat ones. Like you can have dry foods like with almonds. And if you're a fan of sugar, if you're really craving for the sugar, go for dates. Like dates are very common food which we use in Ramadan anyway. So you can have dates which for breaking your fast even, and they are natural in sugar anyway. And always before your meal, always drink 2 cups of water, because whenever you have an empty stomach, you always have your acidity built up in your system. So the water will help to dilute that excessive stomach acid in your system. And one of the another funny thing is, I come across people like whenever they are fasting, they start jumping on the food, and they just eat like crazy. Do not do this kind of mistake. Always break your fast gradually, eat whole foods and lean protein, and always try to avoid, as I said before, processed food. Because I have come across a lot of time people, they just jump on the food. Like the main aim is to fast, and be patient about it. Like it's a very funny saying that some people eat to live and others live to eat. So have a patience, and that's what the holy month is all about, and that's what it teaches us. And in your fitness journey, it's all about your commitment and patience. And patience and commitment go hand in hand. So yeah. Always reach out, as I said. And if you have any question or any question answers. We will be running with I think Dr. Tahir will be running after my session. So if anyone wants to reach out or ask something specific, you are more than welcome to ask. And always seek help from a professional. And do not shy about it. If you don't know where to start and how to start, there is no harm in it. If you're not sure about something, please come out. And there are so many professional people are out there. You can go and ask them, and everyone is individual as a case. So whatever your case is, please go and ask them. Like, I do believe knowledge is a power, ignorance is dangerous, and illusion of knowledge is even worse. So please take care of yourself, and welcome to the fitness world. So I'll go back to the Dr. Tahir and ask him to, if has anyone have question, please do come forward and ask.
Well, thank you so much, Mr. Suleman, and excellent review of exercises that we can do at Ramadan. Thank you so much for your talk.